If I got what I really wanted on Christmas morning in a package for healthcare, this is what I would like, okay? Number one would be Medicare for all. First question, how do you finance that? Medicare for all. The doctors remain private, the hospitals remain private, private health insurances do just exactly what they do with Medicare. They compete for supplemental. Okay? Keep that in mind.
Public option.
Okay, a public option. Yeah, absolutely. Okay. Second, you put a cap on pharmaceuticals. You put a cap on the salaries of the executives and their bonuses. You put a cap on the salaries and bonuses of the healthcare executives too. For those of you who don't know, let me help you out, okay? Healthcare executives in this country last year, when the healthcare was in crisis, we were debating healthcare, they were talking about all of the problems. The average CEO of a major health company got a bonus last year, not a salary, a bonus of $11.4 million. While everybody's premiums went up, while all this was going on. Okay, that makes the guys in Wall Street look like pipelines, to give you a clue, okay? We need to put a cap on pharmaceutical costs. There has to be enough profit in there, though, for them to do research. Both of that is true. But right now, America is paying for the research for the entire rest of the world. We need to look at that very carefully, okay? The next thing that we need to do, okay, is we need to look at fraud. Not just in Medicare, but fraud in profit and non-profit hospitals. The next thing that we need to do is we need to look at hospitals with best practices. They've done all kinds of studies across the United States. One of them is IHC right here. When they went to a non-profit hospital, they had to change their procedures and practices. And you know what we discovered in study after study? Better healthcare costs less. We need to be able to share those practices, and we need to be able to get them into hospitals. Okay? All of those things have to happen in order for this to be cost effective in any way. Will your taxes go up? Yes, a little. But I want you to think about this. The small businessman, who now is also a reasonably small businessman, is mandated to carry health insurance for people, right? Now,
yeah.
Okay?
There's a concern about that too, but I'm going to let
you finish. Okay. Think about if you said to small businesses, your job is now to carry supplemental insurance. You say to large businesses, your job now is to carry supplemental insurances. How much money would you have to reinvest to grow this economy?
Hardly any.
Okay? In other words, if you look at the system, you can't fix it the way they've just done it. There are huge problems. One of them is mandating, coverage. And the people, they do have, their solution to that was to graduate the amount a person had to pay based on their income. Okay, let me help you. If you're making $18,000 a year, I don't care how graduated it is. Okay, I'm talking to students who are probably the poorest you're ever going to be in your life right now. With any luck, this will be the poorest you ever are in your life. And so, one of the things, what if somebody says to you, and they're going to, it's mandated that you have to be covered. If you're not covered, now I realize they just extended students too with this bill, how long you can be covered with your parents. If you're not covered, guess who gets to buy health insurance? Okay? This is you. Okay? So understand that that is part of the health care bill. So if I were to do it, that's what our group would like to see happen. We're the only industrialized country in the world where health care provided for profit isn't a crime. Get that idea. Wrap your minds around that one. Okay, the fact that you are making money and your desire in capitalism is, of course, toward profit at the expense of people's illness ought to be repugnant to anyone who thinks about it for a minute, I think. Okay, so in that case, I don't feel bad about limiting that. And I'm not talking about, they're still going to get their multi-million-dollar salaries, but an $11.4 million bonus per executive? Are you kidding me? I'm talking about a single payer. I'm talking about a single payer system, but privately delivered. You choose your private subsidy just like you do in Medicare. Today, what I love is people say, oh, that's socialized medicine. I don't want any part of it. And then if they're over 65, you say, okay, well then we'll just take away your Medicare. Oh, no, I didn't say that. Okay, it's the same system. Actually, socialized medicine, technically socialized, is the government owns it all. So the governments work for the doctors work for the government, hospitals work for the government, all insurance is government, it's all government. That's not what I'm suggesting at all. Okay? Just for something for you to think about.